Hello, everybody. Hello, good afternoon, and we thank you so very much for being here inside Studio A with us today, WJCT. I'm just going to give you a brief bio on our Dr. Green, who is the founder of the Jacksonville Hearing and Balance Institute. He is a neurologist and a subspecialty of ENT, ear, nose, and throat, that focuses on disorders of the ear. He is recognized both nationally and internationally in the treatment of ear disease, inner ear, and skull-based surgery. Dr. Green has written 8 clinical book chapters and has had 36 scientific articles published in medical journals and has given dozens of oral presentations on his scientific research and work at peer-reviewed meetings. So Dr. Green has also been involved with multiple international medical mission trips, and because of his experiences, he has created a nonprofit organization entitled Hearing Help for Africa, which provides short and long-term health care abroad. So let's give a nice welcome to Dr. Green, and thank you all for being here today.
Thank you so very much. We just really appreciate WJCT and their hospitality and hosting this event, and so we're excited to have such a great turnout. Obviously, it speaks to what a common problem tinnitus or ringing in the ears is. And to lead us off, I'm going to ask Dr. Janelle Kelley. She's one of our audiologists at the Jacksonville Hearing and Balance Institute, to start us off, and we really appreciate you all taking the time from your day to be here today. Thank you.
Hi, like Dr. Green mentioned, I'm one of the clinical audiologists at JHBI, and just to get us started, I have just a little bit of general information about our practice. Now, I see a lot of familiar faces, so I know there are a lot of patients of ours already here today, but tinnitus is just a very small part of what we do. So we do services and evaluations and testing, and even hearing products such as hearing aids. So as you notice, tinnitus is just one part on it, and we do an abundance of services. So now we're going to jump into why you folks came here today, which is tinnitus. We're going to talk more general up here. When you are a patient of ours and we're sitting one-on-one, face-to-face, we really do try to make it as individualized as possible. So this is more general information about tinnitus. Tinnitus is the perception of a sound. However, that sound does not have an external origin. So it is not the AC running, it is not the fridge running in the background. It is your brain creating it itself. And we're going to get more into that as we go on with the presentation. And as a result, tinnitus is actually a symptom, not a disease itself. So it's a symptom of something else going on. Most of the time it's actually hearing loss, but it is not a disease itself. Most people describe their tinnitus as a ringing or a buzzing. That's probably the 2 most common descriptions that I get in the clinic. But I've also heard crickets, chirping, sizzling, et cetera, et cetera. The point is, tinnitus is very individualized. No 2 people really have the same experience with tinnitus. For most people, their tinnitus is constant, so it is constantly with them 24/7. Whether they're paying attention to their tinnitus 24/7 is a different story, but it is with them 24/7 if they try hard enough to listen. For other people, it can fluctuate. So it could be intermittent in its presence. It can fluctuate in pitch, so sometimes it's a low pitch versus sometimes it's a high pitch. And it can even fluctuate in volume. Now, the fluctuation in volume, sometimes that depends on the surrounding environment. So when you're in a quiet situation, nothing really else is going on, you might notice your tinnitus more than, let's say you go out to dinner tonight, lots of noise and background noise on, you might not notice your tinnitus as much. Now we're going to go over the different types of causes of tinnitus. So I am actually going to give the reins over to Dr. Green to talk about first the medical causes of tinnitus.
Thank you. And just a bit about, you heard a lot about me, and I appreciate that, but I just wanted to give some information about Dr. Kelley. She's kind of a regional expert on tinnitus, and we get referrals from all over this area for her to be involved in people's care. And she is just an excellent audiologist and does a great job, and this is obviously an area of interest for her. So we're very fortunate to have her and appreciate her, her expertise. So let's just talk about, Dr. Kelley was mentioning that tinnitus is typically secondary to something. There's something else going on. And one of the things that we try to do from a medical standpoint is to look at some of those different things, to try to do some diagnostics to understand the tinnitus. And the tinnitus is, sometimes it can be just one ear, sometimes it's both ears. And sometimes if it's just one ear, it may be a sign that something, even something serious could be going on. So tinnitus is a medical problem, and it's important if you do have tinnitus that you see a medical doctor or a medical office for evaluation, because as I mentioned, it can be a serious thing. So getting it evaluated is an important part of getting it treated properly. Sometimes the tinnitus can be secondary to a problem deep within the ear, even a problem that can be on the brain itself, an acoustic neuroma. And that's one of the things that we're constantly looking for. This person comes in with ringing in the ear, maybe it wasn't there in the past, it's there now. Could that be an acoustic neuroma? And sometimes we'll even get an MRI scan. Sounds crazy, but just ringing in the ears can, in rare instances, go along with that, and that can be a serious type of a problem. Another problem that can cause ringing in the ear is a problem called otosclerosis. That's a genetic problem that can occur in the ear, and it can cause a progressive hearing loss and can have tinnitus, and that would be a secondary form of tinnitus. Sometimes, in fact, I was just talking with someone else here in the audience about it, sometimes just a piece of wax in the ear can cause tinnitus. One of the things that Dr. Kelley was mentioning was the fact that the outside sounds in your environment can be an important factor in how loud you perceive the sound to be. So if you have wax in your ear, you're not going to hear the outside sounds as much, so you're going to hear the internal sounds at a louder level, and sometimes that's all we'll do. In fact, we just saw a physician last week, and that was the cause of his tinnitus, was just a cerumen accumulation. Likewise, a blockage of the ear by fluid in the ear, much like children get. This is allergy season here in Jacksonville, and so lots of pollen and lots of allergies, lots of congestion that occurs in the nose and in the eustachian tube, and that can result in formation of fluid under the eardrum, and that fluid can block the sound similar to the wax and cause the tinnitus to be at a louder volume than it would be otherwise. And then Meniere's disease is one of those things that sometimes can cause, people think of vertigo when they think of Meniere's disease, but can also cause hearing loss in one ear and a pressure buildup in the fluids and can cause tinnitus. And that would be one of the causes of fluctuating or up and down tinnitus. One of the things that's kind of strange, tinnitus is typically, and 9 out of 10 times, tinnitus is a problem that only the person experiencing it can hear. But there are forms of sounds that occur inside the head that are what we call objective tinnitus. And that's a tinnitus that other people can hear as well. So we will sometimes people will get a pulsating in the ear, and that's also a form of tinnitus. And that can occur for a variety of reasons. And obviously we would want to go through the diagnostics to look into what would cause that. So there are also muscles in the ear that will sometimes twitch and can cause tinnitus too. A kind of a muscular tinnitus is what that's called. So a lot of different things that can cause it, and that's where sitting down with a medical professional is very important to be able to diagnose the cause of the tinnitus. Another important factor is how the tinnitus affects a person's quality of life. All of us, we have a very high quality of life here in Florida. Harold had mentioned we were just in Africa recently, and you realize when you go abroad how great our quality of life is here in Florida. We're very fortunate. The climate, the quality of life, the people are just wonderful people. And, but one of the things that tinnitus can do is it can rob us of quality of life. It can cause us a a reduction in quality of life, so that we're just thinking about the tinnitus and we're not able to enjoy the beaches and the beautiful sunshine and the beautiful weather that we have here. So one of the things that we will commonly look at is questionnaires that assess a person's quality of life, and we'll talk a little bit more about that later on in the talk as well. So tinnitus, the way to think about tinnitus, the majority of tinnitus, that is a problem where there is a neuronal network dysfunction. It's a big medical word, but basically the nerve pathways aren't functioning as they should. And as a result, the tinnitus is bothersome to the patient. So this is a special type of study, a special type of MRI called functional MRI. And what functional MRI does is it looks at activity levels within the brain in response to different stimuli. So they will compare people that have tinnitus with people that don't have tinnitus. And so what they're able to do with this comparison with these imaging studies is to look at what parts of the brain are active in tinnitus patients. And this is a composition of some of those active areas. And I would point out a couple of different things. This is the frontal part of the brain here and here. The frontal part of your brain is an area of the brain that can be important if a person's feeling kind of down in the dumps, if they're not if their quality of life is poor, then that area can be affected. Another area is the amygdala. And this is an area showing the amygdala, and we'll talk more about that here in a few minutes. But the reality is that tinnitus, while it's something that starts in your ear, is actually something that becomes bothersome and affects quality of life in the brain. So a lot of what we're going to talk about here today is what we can do to train the brain, to teach the brain with regard to the tinnitus, and to help improve quality of life as a result. So one thing about tinnitus, there's so many different types and so many different ways that it affects people. Tinnitus, let's say that I take a gun and I shoot that gun, it's very loud, my ears will ring afterwards. Typically the ringing will become less and less and less as the days go by. And that's the brain adjusting to any changes that have occurred in the ear. It's what's called habituation, and we'll talk a lot more about that here in a few minutes. So tinnitus typically will change over time if a person's exposed to a loud noise. If it starts, oftentimes if you don't do anything, it will get better. And it's kind of important to understand that there is a habituation process that takes place naturally, and it works better in some people than others. Tinnitus can also fluctuate up and down, bad at times, not so bad at times, and many factors that are involved in that, including a person's overall cognitive situation, how they're functioning, how they're handling life. Stress can definitely be one of those things that can affect it. And over time, that same improvement in the tinnitus is accompanied by an improvement in quality of life. So if a person has tinnitus, they shoot the gun, they get the tinnitus, not only does the tinnitus improve, but the quality of life will typically improve as time goes by as well. I mentioned questionnaires. These are a couple of the questionnaires that we use. It's called the Tinnitus Reactive Questionnaire or the Tinnitus Handicap Index. They're basically sets of questions that assess how that tinnitus impacts a person and how it affects their quality of life. These are called disease-specific quality of life measures because they're looking at a particular type of problem and not a person's life situation in general. Depression, I mentioned the frontal lobe of the brain is involved. 48 to 60% of people that are severely affected by tinnitus will have symptoms of being depressed or being down. And that's a huge number. So oftentimes that will have to be addressed as a part of the tinnitus therapy. And sleep. Most of you know sleep is one of the ways you torture someone if you want to get information out of them. That's one of the tactics used by the military and CIA and others. So when a person doesn't sleep well, that can definitely lead to more depressive symptoms. It can lead to problems with the tinnitus getting worse. And up to 50% of severely affected tinnitus patients will have difficulty sleeping as a result of their tinnitus. So, and when you don't sleep well, you can't think clearly, you can't concentrate. So that is an important factor in many of our patients. The financial implications are just massive. These are some numbers from the military. 1.5 million veterans have a disability rating as a result of tinnitus. That's a huge, huge number. And the costs for the military alone is $2.75 billion. So huge numbers of people. Some of you may have served in the military. Thank you for your service. And, but it is a huge problem both in the military, and it's also a problem even with people, a significant problem, people who are not involved in the military as well, from other forms of noise exposure. There are also many physical causes. One of the things that seems to affect tinnitus is muscle tension. So if a person is involved in a whiplash-type injury, they're hit from behind, they get a tightening and tensing of the muscles afterwards. Sometimes something very simple like that will cause the tinnitus to get worse. Trauma to the head can definitely be a factor that can make tinnitus work. It affects those neuronal pathways in the brain and can be associated with a worsening of the tinnitus. I read a statistic recently, 75% of people at night will have bruxism, or clenching of their teeth at night. That clenching of the teeth at night increases muscle tension. It can lead to deterioration of the jaw joint, TMJ problems, and it can also cause problems with pain and discomfort from the muscles of chewing, the muscles of mastication, and can cause significant worsening of tinnitus. So I'm going to go ahead and at this point turn the podium back over to Dr. Kelley, and she's going to talk about some of the audiologic evaluation that's done and some of the things that are contributing factors to tinnitus and some of the therapeutic things we're doing.
So like Dr. Green said, we're going to transition into my realm of the tinnitus, which is audiologic. So all the different causes of tinnitus, medical causes, and muscle tension and whatnot that Dr. Green was talking about, those are definitely causes of tinnitus. However, by far the most common cause is going to be some degree of hearing loss. So we come back into my realm. So let me explain that a little bit more. In order to do that, I am going to briefly go over normal hearing. So first, sound waves will come into the ear canal here, and then it'll hit the eardrum. The eardrum is called the eardrum because it vibrates just like a musical instrument drum, and it's going to send the smallest bones in the human body, which is these 3 bones here, into motion. It's kind of like a lever action, and it's going in and out of a hole in the inner ear right here. So the inner ear has 2 portions. So these loop-de-loops up here, they are responsible for balance, and then when something goes wrong, dizziness. We're not talking about those today. We are going to talk about this snail-like portion here, which is going to be called the cochlea, which is responsible for hearing. So within the cochlea are little cells that we call hair cells. Now, it's not actual hair. We call them hair cells because it looks like little hair suspended in fluid. Now, those hair cells are responsible for transmitting sound from the inner ear, which then goes to this hearing nerve, which then goes to the brain stem, which is base of the skull, top of the neck here, and then it goes to, to the rest of the brain. If I were to take a picture of those hair cells, first I want you to look at the top picture here. These are nice and healthy hair cells, so these are normal hearing hair cells. You can see there's a lot of them there. And then they are nice and uniform. They form those little U's that you see. Bottom picture is going to be a picture of hair cells with hearing loss. So they are damaged. So these hair cells are not transmitting sound as effectively as they once were. So that's when the brain says, what happened to my auditory input? I still want to hear all the sound like I did when I was 20. And so what am I going to do? If you've heard, if you don't use it, you lose it. That is true with the neural connections with the brain. If you don't use your neural connections with the brain, eventually they reorganize to be responsible for something else. So the brain doesn't want to lose those neural connections. So what does it do? It creates the auditory stimulation itself. That's when you get tinnitus. So Dr. Green went over some of the areas other than the auditory cortex that are involved in the perception of our tinnitus. One of the ones that I, as an audiologist, am most interested in is going to be the limbic system. First of all, the auditory areas of the brain, they are lighting up. If we were to put someone with tinnitus into one of those MRI machines and we take a picture of their brain, we know that you are hearing a sound because the auditory areas of the brain are lighting up. But another area of the brain that is lighting up is going to be the limbic system. The limbic system is deep within the brain, and it is responsible for very primitive functions. The most important functions for the perception of our tinnitus is going to be memory, emotion, and then the fight or flight response. So with the fight or flight response, let's say way back when we were still hunting for our food, we heard the growl of an animal. Growl of an animal signals to our brain that an animal is close by, and it's time for us to either get ready to run away from it or get ready to fight it. I'm going to bring your attention to the amygdala. Dr. Green talked a little bit about the amygdala, but here it is on this picture here. The amygdala bridges the gap between emotion and memory, so it does have a really big role in the fight or flight response. Let's say 2 weeks later, we heard another growl of an animal. It's the amygdala's job to say, oh, I remember that sound. That sound means an animal is near me again, so I need to get ready to either fight it again or run away from it again. So the amygdala is hearing the tinnitus. Your brain is trying to compensate for that hearing loss, and it's creating its own auditory stimulation, aka tinnitus, and it is hearing that tinnitus. Now I'm going to talk about the two most common descriptions of tinnitus, which is going to be a high-pitched ringing or a buzzing or a static sound. So with a high-pitched ringing, if you think about it, we're taught from a very young age that high-pitched ringings are alarms. So the fire alarm to say the building is on fire, that's a constant high-pitched ringing. When you're being pulled over by the police officer when you're driving, that's a constant high-pitched ringing. Even just to say the microwave, when your food is ready, that is a constant high-pitched ring as well. So we're conditioned from a very young age that constant high-pitched rings are alarms. We need to focus on the source of that alarm, find the source of that alarm, and then do something, whether it's leave the building or pull over or go towards the microwave because your food is ready. So your brain is creating this high-pitched, constant high-pitched ringing type stimulation. Then the amygdala says, oh, I know that type of sound. That's an alarm. I need to focus on that alarm because it means I need to do something. So essentially, when you're listening to your tinnitus, your brain is going into fight or flight mode. Now let's talk a little bit about the static or buzzing type tinnitus. We're taught from a very young age that if you hear a static or a buzzing type sound, that means something is wrong. Static is never good. So when we're flipping through the channels and it goes to a white noise snow, if you will, that means that channel, there's something wrong with that channel. We need to change the television or change the radio. So we're taught from a young age, static is not good. So when your brain is producing the static like tinnitus, the amygdala says, oh, I know that sound. That means something is wrong. I need to fix it somehow. So again, your brain is always going into fight or flight mode. That's where those negative emotional responses come from. So Dr. Green gave a little bit of a preview, but what we want to do is for your brain to habituate to the tinnitus. The process of habituation is like when you first put your shoes on this morning. So you put your shoes on this morning, your sensory system had actually fired off. It sent a signal to the brain. Brain said, those are just my shoes. It's not an important signal. I can put that signal to the background, and I'm going to focus on other things. That's why you weren't really focusing on your shoes until I specifically brought them up. So we want the tinnitus to become like the shoes on your feet. We want the brain and the amygdala specifically to say, oh, that's my tinnitus. It's not an alarm. That doesn't mean anything is wrong. So I'm going to put it to the background, and I'm going to focus on other things. So how do we begin the process of habituation? For most people, it's actually seek medical help. So in 2014, several audiologists, ENTs, neuro-otologists, research scientists, et cetera, they got together and they came up with these guidelines of how to approach a patient with tinnitus. We are going to talk about the 3 top portions. So they recommend a hearing aid evaluation, and I'll explain why they recommend that. They recommend cognitive behavioral therapy for people who are extra bothered by their tinnitus. And then they also recommend some sort of sound therapy. We're going to talk about the options of sound therapy today. But it's important to note what they recommend against. So medication. I'm sure we've all seen several different types of pills or eardrops or what have you that claim to get rid of your ringing. They are available on the market without a prescription for a reason, because they are not effective. If you look at the active ingredients on the pills, it's vitamin A, vitamin B12, lycopene, et cetera, et cetera. It's a vitamin cocktail. So they have been investigated by the FDA, and they are deemed safe. However, they are not deemed effective, which is why they are available without a prescription. Dietary supplements. So a couple years ago, there was a wave of people trying to use lycopene, riboflavin, vitamin B12, and a couple other dietary supplements that also claim to get rid of the tinnitus. Unfortunately, they also do not work. And then the last one, transcranial magnetic stimulation. So this is something that a lot of research centers are looking into for several different types of disease. I can only speak on tinnitus, and it has not been shown to be effective for tinnitus specifically. So when you first start to seek medical help for your tinnitus, you're going to go through our new patient procedures. So first, you are going to get a comprehensive audiometric evaluation by either me or one of my other colleagues, one of the other audiologists. So we will do first otoscopy. So we're going to visually inspect the outer ear portion here, and we will also use a flashlight to look into your ear canal. Like Dr. Green said, sometimes it is just as simple as too much earwax in the ear canal. So we're going to look at that first. Then we are going to do a test that looks at the function of the middle ear. So the eardrum, as well as those really small bones that we were talking about, we're going to look at how they are functioning. Then we're going to look at how the inner hair cells and outer hair cells are functioning within that cochlea there. That's a test called otoacoustic emissions. That's all done outside of the sound booth, and then we put you in the sound booth and we test your hearing either with headphones or with inserts that go in your ears. We do air and bone conduction audiometry. Air conduction audiometry looks at the entire auditory system from the outer ear, middle ear, inner ear, and then up to the brain. Bone conduction audiometry is when we put a little vibrating device behind the ear on this little bone called the mastoid right here, and we look at the inner ear directly. So it's almost like our way of troubleshooting. If something is going wrong, where in the pathway is it going wrong? And then lastly, we're going to do speech audiometry. That means we're going to ask you to repeat some words back to us, see how you are understanding in a quiet environment, in the best environment possible. So after you get a comprehensive evaluation by one of the audiologists, you will see either Dr. Green or one of our 2 physician assistants. So we have 2 physician assistants that work with us as well, and they are actually in the back, if you can see them. There's Donna Smith and Judy Nelson. You are seen by a medical provider first, because we want to rule out any medical causes of the tinnitus that Dr. Green was talking about. They will order any relevant imaging. So a lot of our patients will get an MRI or a CT scan or even an angiogram, depending on your symptoms. They will review your medications, because there actually are some medications that can cause tinnitus. It's called ototoxic. So a lot of those medications are very strong, life-saving medications like chemotherapy, radiation. IV antibiotics, so not antibiotics through a pill, but one through an IV. They'll also review any of your medical history, and then in particular, your ear history. After all of the medical causes of tinnitus have been ruled out, a lot of those patients will be referred to me or one of my colleagues for a tinnitus evaluation. So when you are referred to the hearing center portion of our clinic for a tinnitus evaluation, we will again take a case history, but we are going to be doing some testing of your tinnitus. So this is not a hearing test. This is different. We'll be doing some testing of your tinnitus. We want to get an idea of what you are listening to on a day-to-day basis, because we can't put a little microphone in your ear and hear it. We also can't really see it on you, so we want to get an idea of what you're experiencing. So first, we are going to match the pitch of your tinnitus. We typically play a sound number 1 and sound number 2. They're going to be different pitches, and you tell us if your own tinnitus is closer to sound number 1 or sound number 2. And we do that several times for several minutes until we narrow it down. Then we look at the loudness matching. So we again take that pitch that we match and we start very, very soft. And we gradually increase the volume because we want to know how loud do you perceive that tinnitus. Thirdly, we do something called minimal masking level. So we change to like a white noise or a static type noise, regardless of what your tinnitus sounds like to you. But we do a white noise, we start very soft, and we gradually increase the volume. We want to know if we can completely mask the tinnitus or cover up the tinnitus. And then third is a very interesting portion. It's called residual inhibition. Residual inhibition is a phenomenon that we don't quite understand just yet. What we do is we take that white noise and we play it for 1 minute straight. At kind of a loud-ish level, we play it for 1 minute straight. Then we take it away. Then we ask you to listen for your tinnitus. For some people, the volume of their tinnitus either greatly decreases or it goes away. Now, it's not a cure because after a couple of seconds, it does come back. But for some people, after having stimulation on their ear, the tinnitus is a little bit suppressed. Now, other people, there is no effect. It doesn't really mean anything, but we are trying to gather as much information as possible because we want to know, why do some people have that suppression effect and why do some people not have that suppression effect? So after we do the tinnitus evaluation procedures, we come back in and we explain all the results. We explain the results of the tinnitus eval. We also explain the results of the hearing test as well that was done previously. Then we do a presentation similar to what we're doing today. We discuss all the different sources of the tinnitus and what can cause the tinnitus, and then management strategies. Like I mentioned a couple minutes ago, though, we try to make it as individualized as possible. Right now, we're talking in just general terms, but we try to make it as individualized as possible when we have a patient just one-on-one. So now let's get into different types of management strategies. And notice that I keep saying management strategies because there is no outright cure. These are just ways to help manage your tinnitus. First is going to be the free way. There are several different apps or environmental maskers. We kind of know these as white noise machines. You can purchase them just about anywhere, Target, Walmart, et cetera, et cetera. But now most people have a smartphone. You can download an app on the smartphone. Out on the booth or the table, I actually have instructions on how to download just one of the many apps out there. The kicker is you need to find a sound that you think is relaxing and pleasing. That's the most important. Find a sound that is relaxing and pleasing. For a lot of people, it is white noise. For other people, it's ocean waves, babbling creek, wind chimes, rain, et cetera, et cetera. There's even an app where you can make your own sound if you don't like any of the pre-made sounds out there. So first you find a sound that is relaxing and pleasing. Then you listen to that sound whenever the tinnitus is most bothersome. So maybe it's after a long day, a long stressful day, and you're at home just reading or watching the television. Maybe it's when you're working on the computer and there's nothing really else going on, what have you. Listen to your sound whenever the tinnitus is most bothersome. Now, a lot of my patients will do this wrong at first. If this is the volume of your tinnitus, a lot of my patients go way, way, way above to completely mask it. However, that does not help in the end goal, which is habituation. So if this is the level of your tinnitus, I want your ocean waves, white noise, what have you, I want your sound mixing with the tinnitus. I want it right at the same level. You listen to this whenever the tinnitus is most bothersome. Eventually, your brain will habituate to this sound. Now, it takes time and effort. It doesn't happen overnight. For most people, it takes several weeks to even several months. It's different for each person. But eventually, your brain habituates to this level. You'll know because you'll no longer focus on your tinnitus masking sound. Then what you do is you bring your sound down one volume notch. And you listen to this whenever the ringing or the tinnitus is most bothersome. Eventually, your brain habituates again. Then you bring it down one volume notch, et cetera, et cetera, et cetera, until you no longer need the tinnitus masker. A lot of my patients elect to do that method first. But honestly, for some of my patients, it does not cut it. So we need to talk about the next type of tinnitus masking management system, which is actually ear-level devices or hearing aids. So hearing aids are actually, they have two functions nowadays. One is they're hearing aids. So the hearing aids of yesteryear, so our parents' and grandparents' hearing aids, they were called analog. So what they did is they took all of the pitches, low pitch, mid pitch, high pitch, et cetera, and they just amplified them all. Now, there are very few people that have hearing loss in all of the pitches, in all of the mid and the low and the high pitches. There are very few people that have hearing loss in all the pitches. A lot of people have good hearing at some pitches and then not so good hearing at other pitches. So for those individuals, an analog hearing aid that just amplified everything would actually blow them out of the water. That's why no one liked their hearing aids, and that's why they have such a bad rep nowadays. We're going to fast forward to today's hearing aids. Today's hearing aids are digital. That means that they are custom programmed to fit that individual's hearing loss. So for someone that has normal hearing in the low pitches and then not so normal hearing in the high pitches, they would be getting amplification in the high pitches and not the low pitches. This is important because remember I said tinnitus is caused by hearing loss? By giving your brain the stimulation that it's missing on its own via a hearing aid, it no longer needs to create the tinnitus. So for 99% of my patients, just putting on a properly fit hearing aid either greatly reduces the volume of their tinnitus or it takes it away. Again, not a complete cure, because when you take the hearing aid out, it does come back. However, it is a great way to manage it. Then the hearing aids, the second function of the hearing aids is actually, it's a tinnitus masker device already built in. So if you are using either a white noise machine environmental masker or an app on the phone, you can use it either with the speaker function of the phone, or you can also be using it with headphones or earbuds. However, those options are not always appropriate in every environment. If you're using the speaker function on your phone, everyone else around you hears your ocean waves or your wind chimes or what have you. Then if you're using headphones or earbuds, not always appropriate in every environment, but also it cuts off the rest of the world from you. So if you're working on the computer and you're listening to your ocean waves, someone comes up, starts talking to you, you don't really hear them. So the hearing aids solve those problems. The hearing aids, they are giving you that amplification, but they have built-in sound generators. So if there's a day that the tinnitus is really screaming at you, you can press a button either on the hearing aid or on the phone, because some of them are Bluetooth compatible with the phone, and you can start listening to your ocean waves, white noise, what have you. So it is playing directly into your ears. No one else is hearing it. Then the hearing aids obviously have microphones to pick up sounds in the environment. The microphones are still active. So if you're typing on the computer, so-and-so comes up, starts talking to you, you can still hear them. You're not completely cut off from the world. So they are typically more effective in managing the tinnitus because of those functions there. But you're probably asking yourself, are they really more effective? I am going to be talking about, well, first of all, there's all different styles, all different colors, all different manufacturers, all different prices and performance levels for the hearing aids. I'm going to be talking about one of the few groundbreaking studies in our field. So in 2010, Searchfield and Martin, they did a tinnitus study. Now, 2010 might be a little bit dated now since it's 2018. However, this study was significant because it was the first of its kind. Previous studies looked at tinnitus patients, a group of tinnitus patients, divided them into two groups. One group got counseling only. The other group got a masker, like some sort of environmental white noise machine, but not hearing aids. This is the first study in our field that looked at a group of tinnitus patients. They divided it into two. One got counseling, but the other group got a hearing aid trial. So that's the kicker, is a hearing aid trial. Both groups, so the group that just got counseling and then the group that got counseling plus the hearing aid, did see a reduction in the severity of their tinnitus. However, it is definitely worth noting that the group with both the counseling and the hearing aid trial significantly reduced the reduction of their tinnitus, so much so that it was indeed statistically significant, whereas the other group was not statistically significant. So these researchers concluded that tinnitus patients, especially those with hearing loss and with a hearing loss that is able to be aided with a hearing aid, should at least trial amplification during their management process. Now, the word trial is actually very important because some people don't realize that there is a 30-day trial period in the state of Florida. It's mandated by the state of Florida law. So if you go anywhere in the state of Florida, buy a hearing aid, you can try it out for at least a month. During that month, you have 3 different options. First option, if you like it, you can keep it. Second option, we can switch it out. So we can switch manufacturers, we can switch styles, we can even just switch colors if you need. In that case, you actually get a brand new 30-day trial period with your second pair. But the third option is you can actually return it. If it is not working for you, it is not fitting into your lifestyle, you do have the option to return it. Some people don't realize that. So that word trial, very important in their conclusions there. So, tips for long-term success with the tinnitus, because like I said, there is no outright cure that we can give anyone. Tips for long-term success. So, whatever masker you are choosing, whether it is environmental masker, whether it is an app on the phone, or whether it is a hearing aid with the masker that you can turn on and turn off yourself, the best way for you to have long-term success is if it is first mixing with the tinnitus. So not way, way, way above the tinnitus, but mixing with the tinnitus. Because again, our end goal is habituation. So that is how we are able to habituate properly to the tinnitus. Then overall health. So Dr. Green touched on this a little bit as well. But overall, if we are healthier, we are better able to manage the tinnitus. Stress, sleep, and caffeine, that all goes into our perception of the tinnitus. So first, stress. When our body is stressed and we're producing those stress hormones, our brain goes into fight or flight mode easier. It's just a protective mechanism that has developed over time. So when we are stressed, we are going to notice our tinnitus more. And then sleep. So when our brain is fatigued, we are also going to have our brain go into fight or flight mode easier as well. That means when we're tired. So we didn't get a lot of sleep last night, but also after a long day and you're going to sleep, you are going to notice your tinnitus more. And then caffeine. So caffeine is a stimulant, perfect for waking up in the morning. However, it makes our brain focus on the details more, which makes our brain focus on the tinnitus more. If you think about it, those 3 aspects are kind of like a vicious cycle. So if we have a very stressful day, we might not get a lot of sleep at night. If we don't get a good amount of sleep at night, we're going to have that extra cup of coffee in the morning or maybe in the afternoon. So for a lot of my patients, that is a cycle that we need to start to break. We like to mention, though, that before you start any diet or exercise program or even cut down on caffeine, we like you to talk to your primary care physician about that first. Number 3 is avoid monitoring your tinnitus. So our goal is for you to be distracted away from your tinnitus 24/7. I have patients that come in and give me a diary about, oh, on Friday at 2:30, I noticed my tinnitus when I was doing this. On Saturday at 7:30, I noticed my tinnitus when I was in this environment. Do not write a diary. Do not give me a diary. I'm going to tell you to stop that. Our end goal is habituation and for you to distract away from it. So if you are out and about and you are distracted away from your tinnitus, don't sit there and say, oh, I wonder if I can hear my tinnitus in this environment. I want you to keep distracted away from the tinnitus. And then lastly, seek other counseling if needed. There are some patients that I, as an audiologist, Dr. Green as a neurotologist, and then our physician assistants just cannot provide. We do not have a psychologist or a psychiatrist on board. So for those patients, we do refer them outside of our clinic. We actually have a relationship with one of the counselors at Baptist, but that is an option if needed, and we will make sure to give you all that information of that referral.